The following is a paid program paid for by My ROI Marketing Systems, Inc.
Hey, let me ask you a question. When you wake up in the morning, do you hurt? No, I mean, if you're like me, maybe you've been in a car accident, a ski accident. Okay, in my case, I actually tore my ankle just stepping off of a curb. See, odds are that at a certain age, life has taken its toll on your body. And you suffer from pain in your knees, your shoulders, your neck. And the worst part is when you're in pain, it's just so hard to get a good night's sleep. Well, what if I told you there was a potential solution? See, one that requires no surgery and no downtime. Now, with this type of cutting-edge regenerative medicine, imagine that you can once again be able to live life to the fullest and enjoy all of those things that you thought, well, maybe not possible, like playing with your children, your grandchildren, taking a walk on the beach, playing a round of golf, or maybe just enjoying a good night's sleep. Well, in a moment, you're going to discover how this revolutionary breakthrough in medicine is now available to all of us. See, this breakthrough may potentially help you diminish the pain in your ankles, in your knees, your hips, your shoulders, and even your back. But it also helps with neuropathy and pain associated with arthritis. And on our show, you're going to hear from top scientists, doctors, and patients. Let's get started. I would like to meet my very first guest, Dr. Sophia Beynon. Welcome to the show.
Thank you for having me.
Well, now, you're on a pretty big mission, aren't you?
I am. I want to help people. So my mission is to get information out there, get the word out there about regenerative medicine and the capabilities it has to offer.
So how did you get started? What's your background?
So I'm an internal medicine physician, been in practice for about 21 and a half years. Became interested in regenerative medicine, so I pursued a fellowship in stem cell therapies.
Okay, so we hear a lot about this, but what exactly is regenerative medicine?
The body is designed to heal itself. So when you were young and you cut yourself, cut your finger, it almost healed up overnight.
Right.
And that's because of stem cells and over 3,000 proteins called growth factors that help your body heal.
So we've heard of stem cells, but what exactly are they?
So stem cells is a cell that all other cells stem from. So it's what makes you, you. It makes your eyes, your teeth, your hair, your skin, your joints, even your heart.
Tell me about how many stem cells are in the human body.
So when you're born, you have a lot of stem cells, 1 in 10,000.
Okay.
By the time you're a teenager, that drops tenfold, and it's 1 in 100,000. It drops exponentially from there. When you're 60, it's 1 in a million. When you're 80, 1 in 2 million.
So your ability to heal goes down dramatically as you age.
Exactly. So the result of that can be increased pain, increased inflammation, decreased mobility, decreased quality of life.
So I've actually had regenerative medicine. I've had it on both my shoulders and my knee. I tore my knee in a ski accident, and I will tell you, for a long time, I couldn't walk. It was really, really painful. I was told, though, that I was down to bone on bone. And before this therapy, I would have had to have a knee replacement, right?
That's what most people are told and what most people think. When they're diagnosed with bone on bone, they think there's no cartilage left. There's actually some fibers left, and those fibers are sending out an SOS. They're saying, I need help. There's damage here. What regenerative medicine does is inject it into that area of inflammation. It cushions the joint. It helps the body to send out that signal to recruit all of those growth factors and healing factors that is needed to replace, regenerate, and grow.
All I know is that my knee hurt a lot before I had the therapy, and now I can walk and dance and sit on the floor cross-legged again, and I feel better. I'm even wearing high heels, which I haven't done in a very long time.
It's so exciting to see people get better.
So is there a difference between regenerative medicine and just taking pills for pain?
Forbes, there's a huge difference. So pain pills can help you deal with the pain, they can help decrease inflammation, but they do nothing for the underlying degeneration. Okay. So if you have joint damage from sports, from impact, from trauma, from arthritis, from age, it is going to continue to get worse and worse until all that you're left with is surgery as an option. Until now, regenerative cells are injected into the injured area. They provide cushioning and aid to your own cells to go in and potentially regenerate.
Does it matter if you've had surgery or not on an area?
It doesn't matter if you've had surgery or not, but if you've had an actual replacement of the joint, there's not a whole lot we can do with that.
Now, my knee, I did have surgery on a long time ago. I had regenerative medicine there, and it's way better. So for me, it didn't matter.
Yeah. And that's why I'm on such a mission. I want to get the word out there that there is this alternative therapy that finally might help you feel better.
So my question is, how come more people don't know about this?
So it's been around for a while. It's been around for a long time. But as anything that is new, it takes a while to reach the mainstream. There is an abundance of information out there. Your doctor doesn't have time to research everything new on every condition for every situation.
So how do we learn more about this?
So we offer these free seminars and consultations for you to come in and learn about these therapies and find out if this is something that is right for you.
How does somebody start to feel better?
So Forbes, the best way for an individual who's suffering from pain, who wants to feel better, is to see if regenerative medicine is right for them.
Is this therapy right for everybody?
It is not right for everybody, but for the individuals that it is right for, we see great results. There's this amazing story. Jerry, he's had back pain for 30 years.
Oh, wow.
He couldn't even dry off after a shower. His pain was so bad. He has tried everything. Medications, seen doctors, had surgery, had shots. Nothing worked. He's had regenerative cell therapies, and now he's able to walk again, and he's starting to play golf again. He's gotten his life back.
That must feel so good to be part of that, isn't it?
It's the best thing ever.
All right, well, let's take a look.
When it first started, it was, I would say, a good 9, 10. And now I just don't have that pain at all. It's gone.
It makes you feel very sad to watch someone hurt the way he was. He's much happier, which makes me happier.
Wow, that's just from one treatment.
From one treatment, it's incredible.
When you're in pain, sometimes you don't even know if you want to keep going.
As a community in medicine, it breaks my heart that we've failed these patients. And to give them their hope back, and not just their hope, but results, is priceless.
So do you guys take insurance?
Now, for this type of procedure, we ask patients, you tell us you're in pain, you tell us that you're losing sleep, you can't do the things that you want to do. What is it worth to you to get better? Because ultimately, we are responsible for our own health.
So have we taken away all your doubts? I think we have. If you're suffering, you're in pain, you know what you need to do right now. Pick up the phone and call the number that you see on your screen. You'll be happy you did.
Are you one of the millions of Americans who suffer with pain from osteoarthritis of the knees, neck, back, shoulder, wrist, and elbow pain, or even neuropathy? There is now a solution that does not require surgery or downtime. Regenerative therapy is cutting-edge medicine that could allow you to once again live your life to the fullest and enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf. And now, our regenerative seminars are coming to Fort Myers and the surrounding areas. Call to register for one of our free upcoming seminars near you. If you are suffering with pain, these are must-attend educational regenerative therapy seminars. You'll find solutions that could really help change the way you live. For more information, visit regenerativeseminars.com or call the number on your screen now.
So right now we're joined by regenerative medicine expert and stem cell scientist, Dr. Tim Mosley. Welcome to the show.
Thank you.
All right, so tell me, how long have you been involved with this kind of research?
For 29 years now.
Wow. All right, well, how did you get involved with it?
So I've been primarily focused in orthopedic applications, so trying to heal bone or cartilage, and we realized that the stem cell was actively involved in those processes.
So that occurs naturally in the body.
Yes.
But if you could introduce new ones, what have you guys found?
Primarily, pain is caused by inflammation, and if we can reduce inflammation, which a lot of these signals that are coming off of the cells are anti-inflammatory, and so that reduces that.
So a lot of our listeners have been asking, is this FDA regulated?
So the FDA is primarily concerned with patient safety. They have their own guidelines and processes that need to be adhered to and enforced.
What's the best part of what you do?
Patient outcomes. Everything I've done in my career has been trying to figure out how to translate basic science research or basic cell biology into, patient benefit.
In your years of experience, what kind of patient satisfaction have you seen?
So it's variable, mainly because there's so many different patients and different conditions and different applications that are being used. And often the patient's body can heal themselves when that inflammation is gone.
So is there a difference between regenerative medicine and taking pills for pain?
Absolutely. So the regenerative cells are a natural way of reducing this inflammation because they're producing the signals themselves rather than a drug or a pill that you're taking, which is most likely an unnatural way of doing that.
Where does all this inflammation come from?
Various injuries, different things that have happened over the years that would cause the body to get into kind of a chronic state of injury, trying to repair itself.
So over the years, if you've hurt yourself, you twist your knee or twist your ankle or your shoulder, it's going to get worse over time, isn't it?
Yeah, as you're younger, you seem to heal faster, but as you get older, it's a little bit tougher, a little more difficult to heal, and that's because you have the same number of cells, but they're not as responsive as you get older. So it takes a little bit more to wake them up to be more active.
What else do I need to know as a potential patient?
We're learning now that delivering cells, you're actually delivering the signals that come along with the cells, and those signals can wake up the cells in your own body to help reduce that inflammation.
So basically, we're teaching our body to help heal itself.
Exactly.
The cool part about that is that's a drug-free concept, isn't it?
Yes. Yeah, it's an all-natural process.
So Dr. Mosley, I think that you are truly at the cutting edge of something that's fascinating. And I thank you for joining me today. I love hearing this.
Well, it's
and
my
you out
pleasure.
there, we continue to hear story after story about how this revolutionary science is just changing people's lives. And I got another story for you. Take a look at this one.
I had a rotator cuff in both shoulders, and it was bone on bone. And I was going to a specialist, and they were giving me cortisone shots every 3 months. It would help with the pain for 2 months, and the last month I would always be in pain. If I had to have surgery on my shoulders, who's to say I was going to still be suffering later on down the road? They just injected into my shoulders, and it relieved it. I have my grandson who was born with no eyes, and I do a lot of lifting with him in the car and back and forth and so forth. And now, it's no problem whatsoever. Yeah, and I can reach higher than I could before with my arms, where I could only go so high with my arms, but it's like a new life.
Well, now I'd like to introduce you to a podiatrist. Please welcome Dr. Lou Chiliberte.
Hello.
Lou, how are you?
Good, nice to meet you.
So you started introducing it to your practice, and what have you seen?
I've seen amazing results. I've seen all of that. Decreased inflammation, improved healing, faster healing.
So explain to me, what is your practice like?
So my practice is a foot and ankle practice that encompasses pretty much everything foot and ankle that you could think of. It's a high surgical practice. So I do a lot of trauma, I do a lot of sports medicine, and then I do a lot of elective surgery as well.
Now, tell me a great patient story. Do you have one?
A woman that had come to me who had leg pain for years. Neuropathic type pain, so this was more of a nerve type of an issue. She was complaining of numbness and tingling in her leg. And this woman went on to have a remarkable recovery, something that she was dealing with for years.
I mean, have you seen cartilage grow back in areas?
So I've used this tissue to help regenerate bone, to help regenerate soft tissue.
But people who've been suffering with pain for a long time, have you
Okay.
seen it work for them too?
One of those patients that comes in that says, hey doc, I've had this chronic pain for years. I've tried everything. I've tried physical therapy, I've tried surgery, I've tried corticosteroid injections, I've tried you name it. This is an alternative that you can offer to those folks.
When I started having the pain level went up to 8. And after the treatment, my pain level is less than 1.
All right, so right now we're joined by a regenerative medicine specialist. He's been in the field for more than a decade. Please welcome Dr. Ben Arthur. Ben, welcome to the show.
Hello, thank you very much for inviting me. I'm happy to be on this show.
So what is regenerative medicine?
The whole basis of regenerative medicine is we have a possibility to coax the body to heal itself. So we can have other cells go and talk to other cells and rejuvenate them.
Is what you're doing cutting edge?
About it now that we have to educate people about it. And shows like yours is one of the things that help people to get educated about it.
And who are we helping?
We're helping people that are ailing and have lots of times have tried different agents and that are not working well for them. This approach is a way where you gather natural forces to rejuvenate your body.
So in regenerative medicine, where does this tissue come from?
From the C-section live births, where we use the umbilical cord or the placenta. And the donors are pre-screened and monitored all throughout the process. All these sources have been shown and proven actually to be safe and effective during application.
Now we should say the actual tissue is Parts of the birth that you throw away, like your placenta, your umbilical cord, they had no uses prior to this, correct?
They had no uses. Typically, they would be thrown out. And now we have a new use for them because they contain some things that really bring new life and relief to people that would otherwise be hurting or be dependent upon other agents that would most of the time give them troublesome side effects.
Why would a woman want to donate her tissues?
Good question. There are lots of amazing women out there who are interested in helping people. They can feel for other people. Yeah. Some of these women are among the most amazing women I've ever met.
And you know what? And I love to hear that. Dr. Ben, I want to thank you so much. Keep up the good work. This is fascinating.
Thank you very much. My pleasure.
All right, I hope you're enjoying this as much as I am. But now I want you to listen to a patient who has gotten amazing results. Let's take a look at this.
I had to lay down to watch TV. You know, I couldn't just, sit and enjoy. I mean, I had to lay down. Now I could sit there. I don't even use my recliner anymore. I just tuck my legs in. It's really cool. I have 6 grandkids, and the oldest is only 7, down to 1. So very active. I couldn't be active with them. They got to keep up with grandma. That's how life's supposed to be.
Do you see a lot of people who come back to you and really just want to say thank you?
They do, yes. And that's the best part of the day and the best part of working and doing this kind of treatment. You see people get better. I mean, like Jerry's wife said, he's happier, she's happier.
Right.
These people just get so worn down by pain, so worn down by being sick and tired, that once they start to feel better, their personality gets better too.
Oh, wow.
So they come in grumpy because they're painful, they hurt, they don't want to move, and then when you see them after treatment, they're smiling, they look brighter, they look younger, they're standing up taller. It's just amazing.
You basically gave them their life back.
Gave them their dreams back.
Do spouses also come to you and say thank you?
Yes, yeah, because they've been on this journey with their spouse, and they are frustrated that they can't do anything to help their loved one, and they are just tickled when their spouse gets better, feels better, and is able to do stuff again with them as a couple.
Are you one of the millions of Americans who suffer with pain from osteoarthritis of the knees, neck, back, shoulder, wrist, and elbow pain, or even neuropathy? There is now a solution that does not require surgery or downtime. Regenerative therapy is cutting-edge medicine that could allow you to once again live your life to the fullest and enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf. And now, our regenerative seminars are coming to Fort Myers and the surrounding areas. Call to register for one of our free upcoming seminars near you. If you are suffering with pain, these are must-attend educational regenerative therapy seminars. You'll find solutions that could really help change the way you live. For more information, visit regenerativeseminars.com or call the number on your screen now.
So it's my great pleasure to introduce you to the editor and publisher of Pro Football Weekly. Please meet Mr. Hub Arkush. How are you?
I'm good. How are you?
Now, you have a very interesting story to tell. You were in pain for a lot of years, weren't you?
I was, yes. A lot of years from a lot of places. I had had surgeries on both my knees. I've had back surgery. I've had elbow surgery. I've had a lot of surgery.
Wow.
And the knees in particular, though, I had been to several doctors who'd recommended complete knee replacements, and I said, no, I'm not going to do that. But I also reached a point where I couldn't go much further. And I heard about Dr. Howe and her treatment, and I had stem cell injections in both knees. The left knee is 100% pain-free. It's just tremendous success.
Okay, should I do this? Should I not do this? What would you recommend?
Well, I've had great results, so I would say do it.
So do you feel it's a real improvement in your quality of life?
I mean, the last couple of years, it had gotten to the point where the right knee was pretty much on fire all night long. I mean, it's really completely taken care of my biggest concern, which was just the ability to do normal things like get a night's sleep.
Well, so give me on a scale of 1 to 10. So at its worst in the middle of the night, was it a 10?
I always say 9.5 because I assume there must be something worse than what I'm doing. But yeah, it was right there.
And so now at 9.5, that's pretty bad. And now?
At night, 0. I was taking anything I could get my hands on for a while.
Right.
I wasn't an addict, but I mean, all the prescribed painkillers, all the non-prescribed painkillers. I haven't taken a painkiller at all since I had the shots.
So, Hub, I want to thank you very much for being my guest. Well, right now, I'd like to introduce you to a very special guest who's joining us from Denver, Colorado. Now, he works with professional athletes some of who you know, but I'm not going to say. Please welcome Chris Nisler. How are you?
I'm doing great, thanks.
Tell me, what is it exactly that you do?
Well, I'm a performance-based rehabilitation coach. So I work with athletes, active individuals, but primarily my main focus is elite and professional athletes.
Have you been using regenerative medicine in your practice?
I have. I've been using it for the past 6 years.
Okay, so explain to me, how do you actually use it, and what have you seen?
I mean, the NFL, I mean, it's like going through a major car accident every week.
Right.
So by incorporating them into our therapy, we're able to keep them feeling better and moving pain-free and preventing injury. In order to get through that marathon NFL season.
So what part of the body do you find it works most effectively in?
Man, I really haven't had too many experiences where I haven't seen success with it.
Well, and I venture to say that you came all the way here to talk to us today because it's important. I think this is a medical breakthrough.
Yeah, I mean, I would definitely agree, and it's, you know, I've spent the past 6 years of my life kind of waving this banner and showing people what it does. I've seen such great results with it. It's something I'm very passionate about. I mean, the thing that gets me out of bed every morning is having my players call me, text me, and say, "You wouldn't believe how good I feel. I mean, I'm out moving around, like I was able to throw today and didn't have any pain." I mean, that's the reason I got into this.
Chris, I want to thank you so very much for your time, for your passion, and I think you get to decide for yourself. If it's good enough for professional football players who ram into each other in the NFL, Mom, Dad, Grandma, I think it's good enough for us to try out.
4 years ago, I broke my neck, and I was in pain. I got up in the morning, I had pain. I had pain all day. I went to bed at night, I had pain. I was in the hospital 3 different times with just an excruciating pain. It was the worst pain I've ever had in my life. You have that pain for so long, and then when it gradually goes away, it's amazing. I just can't say enough good things about it, to be honest with you. I didn't have any pain in my neck for the first time in 4 years.
My pain level went from a 10 down to perhaps a 2 or even a 1. The major thing, however, is at the start, when I could only walk, let's say, 3 blocks and get to a pain level of 10, now I can walk probably 3 miles before I get to any significant pain level.
Are you one of the millions of Americans who suffer with pain from osteoarthritis of the knees, neck, back, shoulder, wrist, and elbow pain, or even neuropathy? There is now a solution that does not require surgery or downtime. Regenerative therapy is cutting-edge medicine that could allow you to once again live your life to the fullest and enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf. And now, our regenerative seminars are coming to Fort Myers and the surrounding areas. Call to register for one of our free upcoming seminars near you. If you are suffering with pain, these are must-attend educational regenerative therapy seminars. You'll find solutions that could really help change the way you live. For more information, visit regenerativeseminars.com or call the number on your screen now.
So we've heard how stem cell therapy can positively impact your knees, your back, your neck. But imagine it can also work in your mouth? All right, well, joining me now is dentist and implant surgeon, Dr. Oleg. I'm so excited to have you come to the show.
It's a pleasure.
By the way, you're not only just a doctor, you're also a patient.
Yes, I am.
So you've had the stem cell therapy where?
In my knees.
Okay, what was going on in your knees?
Several years ago, I was having difficulty walking upstairs or taking big steps, walking up ladders. Not that that's part of my job, but just regular things that would make your life difficult.
On a scale of 1 to 10, how severe was the pain getting?
It was getting up to an 8.
Oh, wow.
I'd have to say.
What kind of activities did your knee pain keep you from?
Walking a lot, hiking, household chores, even getting in and out of the car was difficult sometimes, stepping up into it, and it just took a lot more effort.
And your results?
My results were phenomenal, actually. My knees are back to where they were 10 years ago. I have no pain whatsoever right now in them, as if nothing has ever happened.
All right, so you're telling me your pain went from a 7 to a 0?
8 to a 0.
8 to a 0, that's even better.
Yeah, it's remarkable.
Yeah, and did you notice that it gradually got better and better, or was it all at once?
It took several weeks to a month before I started noticing a lot of improvement, but then it just got better and better to the point where 8 months in, I had no more pain whatsoever doing any activities.
So now, as a patient, this worked wonderfully.
My life has improved drastically from being able to live a pain-free life and do the things that I once enjoyed doing and continue doing them.
Yeah.
Well, now that my knee doesn't hurt, I look forward to life, waking up every morning and doing the things that I used to love to do.
So somebody out there is listening to this conversation right now. What do you think they should do for real?
If they are having pain in their joints, they haven't been able to relieve them with conventional methods, they should certainly inquire about getting a consultation or information about this kind of therapy.
If you made a decision that you no longer want to live with pain, whether it's in your ankles, your knees, your hips, your lower back, you know what you need to do.
Are you one of the millions of Americans who suffer with pain from osteoarthritis of the knees, neck, back, shoulder, wrist, and elbow pain, or even neuropathy? There is now a solution that does not require surgery or downtime. Regenerative therapy is cutting-edge medicine that could allow you to once again live your life to the fullest and enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf. And now, our regenerative seminars are coming to Fort Myers and the surrounding areas. Call to register for one of our free upcoming seminars near you. If you are suffering with pain, these are must-attend educational regenerative therapy seminars. You'll find solutions that could really help change the way you live. For more information, visit regenerativeseminars.com or call the number on your screen now.
Dr. Sophia, it has been spectacular getting to meet you, hearing stories, but also just knowing that there's so much hope for people out there now. Yes?
Yes. You know, this is the great thing about this day and age, is that we have this potential to help people. We have this potential to end suffering. We have this potential to get people healthier.
Because in life they say there's nothing more important than your health.
No, and it affects everything. So if you have poor health, it affects every aspect of every other part of your life and everyone you interact with. And so being able to educate people about this opportunity is my dream. It is what I enjoy doing, and it just gives me the most satisfaction. It's the reason I went into medicine.
Dr. Sophia, I want to say thank you. This has been really helpful and educational, and it's nice to see that there is hope for people.
Definitely. Yeah, I mean, you don't want to see people living out their lives in pain and suffering. We don't want people to get to the point that their disease has degenerated so much that they are confined to a wheelchair, they can't get out of their home, they can't enjoy their retirement. They're living in constant pain and they are constantly suffering.
Well, we always talk about the most important thing about life is your health, and certainly your quality of life, right?
Definitely.
And that's the hope that we're offering people.
Exactly.
And so what do you get most excited about?
Seeing people get better. You know, that's the reason most of us went into medicine to begin with. You know, we want to help people. And this is the first time in a long time that I've felt that we actually have the potential to do that.
There is at least a step you need to take. The number's on your screen. Now's your opportunity. Call us, reach out. There is hope.